Good evening, everyone. Welcome to this National Single Payer special session on how the citizens of rural Dunn County, Wisconsin put national single payer on the ballot. We're happy to have you with us for this event. I am Kay Tillow. I'm a lifelong union activist, currently engaged in working for single payer, and I live in Louisville, Kentucky. I will be facilitating this discussion. National Single Payer is a nationwide grassroots organization that organizes locally but focuses on the struggle for national single payer healthcare. We are united by the common principles that healthcare is a human right, must be free from corporate profit, and must be achieved through national legislation. This session will begin with our two guest speakers, John Calabrese and Dr. Lorene Vedder, two of the Dunn County, Wisconsin organizers who got national single payer on their November ballot. They will speak between them for approximately 30 minutes. And following their presentation, I will ask some questions that will allow them to expand on their strategy and experience. Following that, Dr. Judy Albert, a physician in Pittsburgh and a member of the steering committee of National Single Payer, will be presenting questions sent in through the chat to our speakers. Note that we will not be calling on participants and all will be muted except the speakers. So please send your questions through the chat, and we do very much want to hear from you, and you can begin at any time. So I will now introduce our speakers. John Calabrese is a woodworker, an elected member of the Dunn County Board of Supervisors, and an organizer with Our Wisconsin Revolution. Dr. Lorene Vedder is a physician, active in Physicians for a National Health Program and in Wisconsin United to Amend. She has been involved with 4 local referendums, 3 from United to Amend, and 1 that was for fair maps. She is also involved in community conversations, a discussion group of concerned individuals that are active in social justice. John and Lorene, the floor is yours.
I think, thank you, Kay. It's wonderful to be here and to see so many faces. And I think that Lorene is planning to go first in this presentation, but I know she's muted, and I think we need to allow her to unmute, as I was, and I'm not exactly sure of that process.
Can you do that, Judy?
Yeah, I'm trying to do it.
Thank you.
Oh, this is great. I asked everybody in the chat if they could put where they are from, and I see Wisconsin, Indiana, Connecticut, Arizona, New York, Texas.
Lorene, I just made it okay for you to unmute yourself.
Okay, here I am. My name is Lorene Vedder. I'm a retired internal medicine physician from Menominee, Wisconsin. At the start of my career, I had medical school rotation in Campton, Kentucky with Dr. Maddox in 1972. He was the only physician in Wolfe County, Kentucky. His office visits were $4, and he had large jars of medication from which he dispensed medication to his patients to meet their needs. Dr. Maddox worked 7 days per week. When I finally started general practice in Stevens Point, Wisconsin in January of 1975, my office calls were $8 per visit. This was a time when medical treatment was affordable and the primary allegiance of the medical doctor was to his or her patient. Fast forward to the turn of this century with my retirement, medical care has become unaffordable. Insurance has become a must to be able to access healthcare. It is our country's expectation that insurance for healthcare will come from employers for those not on Medicaid, Medicare, or the VA coverage. There remains also the gap in insurance coverage that requires that citizens and residents who do not receive insurance from an employer will need to buy their own policy. But many individuals have been unable to afford that coverage through the marketplace. At the end of my medical practice, a county social worker and I toured Wisconsin free clinics in order to find out how to set up a free clinic in Dunn County. The most significant lesson we learned was that the free clinics used 90% of their funding to pay for drugs that their patients had to take for their medical issues. These free clinics had limited lab tests and diagnostic tools, and many treatments were not available due to limited funding. When we set up our free clinic of the greater Menominee area in the spring of 2005, our solution to drug costs were to enlist a number of local pharmacists who were willing to provide generic drugs at cost. We also used pharmaceutical companies' assistance programs for expensive brand name drugs. We had the good fortune of the Mayo Clinic being supportive of free clinics. Mayo allowed a place one night a week to have a free clinic, provided equipment for evaluations of our patients, provided laboratory and X-ray evaluations, and occasionally allowed free access to consults with specialists and surgery. Providers, social workers, and medical personnel volunteered their time. Let me tell you that this once weekly help was greatly appreciated, but it was only a drop in the bucket to fill a great need to provide quality health care. I personally felt that perhaps the 2010 ACA was eventually going to fill that need, but insurance by corporations that need to make a profit were the backbone of that plan. Another problem has evolved with our for-profit medical corporations is that medical students are taught many times a day on how to charge for service provided. Employees must be careful not to miss a charge that would hurt the bottom line of the corporation. Back in the early 1970s, we never had any instruction in medical school on how to bill for services. Now we have changed from the ideal of the physician's primary responsibility to the patient and the community, as it was with Kentucky's Dr. Maddox, to the primary responsibility to make money for a corporation. Another historically significant event in 2010 was the ascendancy of corporations to super citizenship in the United States by the Citizens United decision of our federal Supreme Court. This same court had recognized that corporations had personhood rights in the 1800s. In 1976, the court ruled that money was equivalent to free speech. In 2010, all gloves were off. Corporations could put unlimited money into political spending. Since then, money has poured into campaigns by the wealthy and by special interests with no signs of slowing. In 2013, my husband Mike and I decided to join a group of activists in an adjacent county to help us pass a referendum that corporations are not people. They don't breathe, they don't eat, they don't have to raise families, and they never die. If they kill someone, they can't be thrown in prison or executed. The second part of the referendum was that money is not speech, and we as a government should be able to restrict the amount of money in political campaigns. The end game for this referendum was to amend the Constitution so we could be able to overturn the U.S. Supreme Court ruling of Citizens United. The local sentiment in my community in Dunn County is that money has corrupted government and that we, the people, no longer have a voice in our government. Government is run for the wealthy and special interests of our country. And as corporations are multinational, that means foreigners have an undue influence in the laws and policies of our government. In Wisconsin, there is no direct legislation as there is in 23 other states. Our referendums are only advisory. We would hope that our state legislators and our congressmen and senators would listen to our needs when we pass one of these referendums. Our state legislature in Wisconsin repetitively ignores the public will as expressed in advisory referendums, especially since 2010. That is the year when Republicans took over our entire state legislature and the governorship. Our referendum to overturn Citizens United passed by 72% in Dunn County in November of 2014. The referendum for the same passed by 90% in 2016 by a village in an adjacent county. The referendum for the same passed by 75% November 2018 in St. Croix County, a very conservative county that is 3 times larger than Dunn County. A different referendum in Dunn County against gerrymandering passed in November 2020 by 64%. I've been involved with the processes of these 4 referendums. Our Wisconsin Republican-controlled legislature will not move any legislation forward for the constitutional amendment to end the corrupting influence of money in politics or draw unbiased election district maps. After our victory in the 2014 referendum, we spoke to our local Republican assemblyman and the Republican state senator. They were attentive, but admitted to being unable to make any impact in proposed legislation for Wisconsin. In late 2015, we started a group called Community Conversations to discuss political issues in a nonpartisan format. From this group, we have activists who pressure our local government to work in our interests. That is how we have been able to get referendums on our ballot for the Fair Maps referendum in 2020, and now our current 2022 referendum on healthcare that will be on our November ballot. We are grateful that local government represents us and that big money has not been able to corrupt our local politics. In regards to healthcare, I believe that our broken healthcare system is a big issue for our citizens. Citizens are angry because their healthcare needs are not being met in the wealthiest country in the world. They are angry enough by their needs being ignored in many issues to want to overthrow our government. In our current healthcare system, citizens are dying here in the United States at younger ages as they are reluctant to access healthcare. Many are either uninsured or underinsured and unable to pay the deductibles and copays for healthcare. Or their insurance companies delay or even deny care. When the poor are finally sick enough, they go to the ER, where their disease may be too far advanced to be cured or even treated. Many families who do access healthcare are bankrupted. So what have we done here in Dunn County? Our citizenry in community conversations, those of all political stripes, have gone to our county board and asked for a voice in the form of a Wisconsin advisory referendum to ask for a redo of our current broken healthcare system. We are asking to do away with for-profit insurance that's run by private insurance companies in favor of publicly financed nonprofit insurance providing healthcare for all residents of our country, regardless of individual financial status. We are well aware of the complexity of putting together a new plan and the opposition by special interests making unbelievably large profits off the current system. As we look at how to word a referendum for our county, we have tried to stay away from politically controversial terms, single payer, universal health care, and Medicare for all. Everyone currently experiences a problem with the healthcare system that has evolved in this country. We can all agree that something needs to be done. We as a country need to support the healthcare of all of our fellow citizens and residents. We need government that addresses fairness in the use of our combined resources to help provide healthcare, just as we do with providing transportation, maintaining our roads, and providing clean water, law and order, and defense of our nation. In July 27, our county supervisors voted unanimously to allow us to have a referendum on healthcare on the Dunn County ballot for November 8. Nicholas Lang is our county attorney, and he has sent this resolution to our representatives and senators in Congress, as well as to all the counties in Wisconsin. I would like to point out the amazing job done by our County lawyer Nicholas Lang in expressing the concerns of those that testified at the Dunn County board meetings in June and July of 2022. His whereases on the resolution are: every person deserves access to affordable quality health care. He points out the crisis of increasing healthcare costs. He speaks of those who forgo treatment because of healthcare being unaffordable. He also speaks about the substantial numbers of people who, due to illness, are unable to work and therefore can't pay for their medical care, and the bankruptcies that this causes. Our lawyer in this resolution suggests that we could actually expand benefits for healthcare with a national publicly financed health insurance program. We could eliminate inequities in our current system. We could eliminate network limitations as set up by insurance companies, and we could control costs of medical treatment and drugs. In the end of this resolution, he states this referendum allows for a voice for the people in Dunn County about whether or not they support publicly financed nonprofit national health care insurance plan. Thank you for listening.
So, John, you should be able to unmute now.
Yes, thank you, Judy. Yeah, and thank you, Lorene, and wonderful background about what's been going on in this country, and how things have descended into where they are. And I really appreciate it, and I also appreciate all of Lorene's work and all of the referendums and everything she's done in this county. It's a great group that Lorene has that I've been proud to be a part of. And so what I want to talk about for my time is just generally what happened, to paint a picture of the scene at the Dunn County Board of Supervisors and how it all came to be. And kind of elicit some questions from everybody about how this could maybe move forward in other counties, other states, and across the country. Last year, this group that I joined, Our Wisconsin Revolution, they had a reboot. They were born out of the Bernie Sanders campaign, and then they sort of went off in their own direction. And they did electoral work, endorsing candidates and things like that. And then they wanted to sort of tackle issues. And I was hired on as a staff member. And when that happened, I had been on the county board for approximately 3 years, 3.5, I would say. And I had an idea about bringing the healthcare issue, because I know that Medicare for All was a big tenet in the platform of Our Wisconsin Revolution. And I felt like on the county board that I was seeing something that most people didn't see. And what that was that Dunn County is a small county, 45,000 people. It leans conservative. It voted for Donald Trump in that last election. And it's largely rural. There is Menominee is the name of the county seat, and that's where Lorene and I are. And there's a university there. It's called UW Stout, and it is the only polytechnic university in Wisconsin. But outside of Menominee, it's all rural. There are a few little villages and townships. And so when I joined the county board, it was in the wake of running for state assembly a couple times, and I was entrenched and focused on state politics in Wisconsin and national politics. And in my mind at that point, I thought, boy, the divide is crazy, and the rancor is palpable, and people can't agree on anything. And so when I got onto the county board, I thought it would be something akin to that, maybe more at a local level, but I thought that there would be back and forth, and I steeled myself for those debates. But then when I got there, I realized that it wasn't that at all. I was pleasantly surprised, and there was 29 board supervisors. And so in this conservative leaning rural county, it would stand to reason that many of them are conservative, and they are, and I'm sure they vote that way in November. But in my 5 years, I have not had a rancorous discussion with anybody. And that is what led me to think of presenting something to county boards, because what they're trying to do is just deliver the services for the people of Dunn County that they rely on. They plow the roads, they pave the roads, they keep the nursing home open, the sheriff's department, the jail, all the things that fall under the purview of the county. And so they take the taxpayer dollars in a pool. The state of Wisconsin mandates that each of the 72 counties balance their budgets each year. And so those supervisors are tasked with, okay, how do you take this money and how do we balance the budget at the end of the year? Do you borrow? There's really not a lot of ways to raise revenue. And so what I would see was at the end of the year budget time, they were cutting $1,000 here, they were cutting a few jobs here, pulling their hair out to balance this budget. And what I also saw on the administrative committee is that every month, Dunn County, one of 72 in Wisconsin, was spending on average for health insurance for their employees $500,000 a month, $500,000 a month for health insurance for their employees. And so that was a full 10% of their budget. And I would see people who I knew were conservative looking at those numbers every month and being very stressed out about those and wondering why it had to be that way. And so with our Wisconsin Revolution in our healthcare committee, we started to talk about how can we bring this to counties? What can we do? And because the conversations were different there, they weren't the same of political nature at the state and national level. And we first thought about a resolution just through the county board saying that Dunn County, or any county actually, we weren't focused on Dunn County at the beginning, any county to pass through their county board that, Dunn County, the elected officials of the county board say that we want a publicly funded national health insurance program. But we shifted the chair of that committee, my friend Steve Carlson. He suggested having a referendum on the ballots. And, many of us didn't know that that would work. And I thought of my county and I thought of the deliberations and God, how would that actually pass? But we went forward with it anyway. And Steve came up with the language of the resolution. And for those of you who don't know, I'm going to read it to you. And I know Lorene mentioned that that it doesn't have those buzzwords. And we did that really purposefully, because whether people know it or not, those terms, Medicare for all, single payer, universal health care, they get into the ether, they get into their mind, and they think it's a polarizing political issue. And so this is the language that we came up with. Shall Congress and the President of the United States enact into law the creation of a publicly financed nonprofit national health insurance program that would fully cover medical care costs for all Americans? And Lorene brought this before the executive committee of the board in June of this year and asked that they would talk about it. She just asked that they would talk about it. And these good people on the board, they heard her. They appreciate public comment. We don't get much public comment on the Dunn County board. And one supervisor who runs the legislative committee said, okay, we'll put it on the agenda for next month. And we didn't know how it would go. And Lorene, through her groups that she mentioned with community conversations, she rallied over a dozen speakers to come to that legislative committee meeting. And they spoke of the stress and the anguish and the horrors of our health insurance system in this country. And they spoke of what that means to them and their families. And then another supervisor, Monica Barrier, she also spoke, and she spoke about the financial aspects of how it affects the county. And I saw the supervisors listening, and they actually listened. And the only questions that we had in terms of a debate about this were not, I never heard any supervisors say, this system that we have in this country is fantastic, and I don't want to talk about this. Everybody started their comments with, we know there's trouble. We know that this system isn't working well. And this is why this issue, we think, can really break through the partisan barrier. It's one of the issues that affects everybody, whether you're young or old. Everybody's going to age, everybody's going to get sick. Everybody has dealt with the paperwork, has dealt with this oppressive, profit-driven at the very least annoying, at the most vicious system. And so even these conservative supervisors, they know what goes on in this system. And so the only questions we had were, how does this fall into the purview of Dunn County? What will this accomplish? Will it cost the county anything to put this on the ballot? And what was really striking was that nobody was saying, I love this system. And due in part to the language of the referendum, all the people that came to speak, and the county's deep concern about its finances, it passed that legislative committee unanimously. And one of the great things that the speakers did was not just talk about the system. They appealed to the county board and to their nature of being a local body of government that is most responsive to the citizens. And I think Lorene did a great job of reminding the supervisors, and so did many of the people that she brought to speak, that that the citizens are not asking the Dunn County Board of Supervisors or any board that we push this forward in. We're not asking them to fix our healthcare system. We're asking them to put this question to the citizens that they represent. And they heard that. I could see them hearing that. They thought, okay, we want this conversation to happen between August and November. We are willing to put this on the ballot because many of the people who came to speak, it's a tight-knit community. Many of the speakers knew many of the supervisors, and they just said, please, let us have this conversation. And if it doesn't pass, it doesn't pass. And if it passes, that's fantastic. And then it went to the full county board the next week, and with a few more speakers and just a perfect storm of some things that happened at that county board meeting. And one of them was this wonderful cinematic moment where Lorene stood at the podium, and there were another dozen speakers, but the room was packed with probably 30, 40 people. And Lorene said, would everybody in the room who is in favor of putting this referendum on the ballot please stand up? And all the supervisors turned around and looked, and everybody in the room stood up. And it was quiet and powerful. And it just so happened also that month, the Health and Human Services Director was delivering her annual report. And she talked about how, it's not just the health insurance for the employees. There are so many things that are tied to health insurance. The county is mandated by the state to provide mental health services for people who, through the sheriff's department, who run into trouble, who get called in on law enforcement calls. And many of those people that the county deals with don't have health insurance on their own. And the county has to deal with that paperwork, and they have to deal with providing the mental health services for those people. And the most conservative member of the board, if anybody asked you, they would say this was him. After this report, he saw how much money Dunn County was spending on these mental health services, and he raised his hand and talked to the Health and Human Services Director, and he said, and he pointed like this with his thumb to the back of the room, and he said, well, this thing that these people are talking about, if that ever came if that came to be, would that help with some of this stuff? And the Health and Human Services Director said, well, yes, like that would all be covered. And so due to him, due to the speakers, due to this perfect storm, it passed unanimously in this rural county that leans conservative. And it was one of the most wonderful moments of my life. And I think that in between now and November, we're going to be pushing this conversation forward throughout Dunn County. And we just want, as all of you on here who are well-versed in all of this stuff know, it's almost maddening, and you want to pull your hair out or what's left of it and just say, this should be dealt with like we deal with the fire department, because everybody is affected by this. And that's the conversation that we want to change. You ask anybody, left, right, conservative, liberal, everywhere in between, what do you think of the fire department? And they'll say, what are you talking about? We need the fire department. How are we going to pay for it? And we all need health insurance. And we just want to shift the conversation. And the Dunn County Board of Supervisors heard us, and they said, all right, we'll put it on the ballot. And it was a wonderful story. And we're all very proud of it. And we're proud of all our friends and neighbors who helped in the effort. And we're glad to be here. And that's the story.
Thank you, Lorene and John. I love this story. As everyone knows, I've been working very hard to try to spread the word around to people in the country to see what we can learn from it and what might be possible for us to do to build our movement based on these kinds of ideas. So I have a series of questions for John and Lorene. Could you tell us what's been the response of people in Dunn County to the referendum since the vote was taken?
I haven't heard a whole lot from people. I've written to all of the municipal clerks in Dunn County. You sent out a poster about that we will have an explanatory meeting with community conversations next week on October 4, and gave them a poster on that with the wording of the referendum. And hopefully they've posted that. And hopefully, you know, it's getting around that we're willing to explain what this is all about, but none of the clerks got back to me, even though I left all my contact information, they never got back to me. So, you know, it's with the WIUTA, you know, the Wisconsin United to Amend. We never know really what's going to work. You know, we can kind of tell during these referendums, you know, where we make mistakes and we could do better. But we don't know how that one's going to work. So we don't know how many people will show up. I know that the people that are involved with community conversations, you know, would really push this. But I really want to get those other people in, you know, the people that have questions about this. And so we'll see what happens on October 4th.
The people that you organized to speak at those meetings were really very moving, and that is what they said is up on the website of the Dunn County Commissioners. What did you say? How did the presidential vote go in Dunn County?
Okay, I just tabulated those up. Back in 2016, when we had Libertarian running, Trump didn't get quite so many votes, but he did get 52% voting for him of all the voters. And then in 2020, he got 56%. So there weren't as many other choices for them. So we have an actually very conservative county that are afraid of Democrats.
Let me ask this. Why did you decide to begin this campaign in a rural county?
Because we had John, and we have a bunch of activists in our county that, you know, we were complaining about what was happening to Medicare. We were making big noises about that. And I think that OWR was impressed that we could, you know, gather all those people together. And so then we just threw it at the committee at the Dunn County Board of Supervisors. And, you know, I think we have an effective group of people, you know, that can push for getting our voices heard.
Yeah, and I think it was shortly after the reboot of our Wisconsin Revolution happened, and once we got on the path with the healthcare committee, it was getting down to the time where there wasn't much time left to get something on the ballot for November, because Wisconsin statute says that you know, in order to get the ballots printed and through the county board, you have to have it done in a few months before the election. And because I went on staff with OWR and my connections with people here, drawing people into that organization, my friend Monica Barrier, who's on the County Board of Supervisors, my friend Andrew Hagan, they were all running in the spring elections that we have here, and our Wisconsin Revolution endorsed them. And so we just had this core of people, and so we thought, why not? And what that told us was that the importance of having local people can't be overstated. And so as we go forward into other counties in Wisconsin, we need to build this organization. We need to build local people to speak on it, because, you know, the rural county boards are, they're quiet, but they're very prideful. They love their county. They don't get paid for what they do. They're not in it for the money, and they're weary of outside interlopers. And so if a group called Our Wisconsin Revolution starts to go into some even more rural counties or more counties in the north, then, we will be turned away immediately. But if we can bring people in those counties who not only know the supervisors, but just our residents of those counties, that's the formula that we've discovered that is very key. If some organization just comes in and says, we'd like this on your ballot for your citizens, and they're from Dane County, where Madison is, or Milwaukee County, then these rural counties will raise their eyebrows, and they don't just roll over. And so the key is to find local people who are really passionate about this, and they're out there. There are, like I said before, as you all know, everybody is affected by this. Everybody in Wisconsin, and probably in most other states, sees those flyers and those posters on bulletin boards about benefits and fundraisers for people who can't cover their medical care costs, and we need to appeal to the better nature of all these supervisors, and we think that this is the great level to go to, because conservative, liberal, everywhere in between, they really care about their neighbors, and so that's why we went this route, and we need to continue this way.
So you've answered what was going to be my next question, which was the broad participation effective in winning the Board of Supervisors vote to place the referendum? And obviously you're saying that was the key, was the participation of the people from the county in speaking, and also in attending the meeting and in showing their support for this. Could you tell us how you're campaigning to win the vote on the referendum?
Sure. Well, as Lorene said, on October 4th, her community conversations group is going to be hosting a program about it to spread the information. We've reached out to local groups. We reached out to the local Democrats, and much like I wasn't certain that we would pass at the county board, let alone get a unanimous vote. I didn't know what the local Democrats would do, because there are many Democrats, as you all know, who are not in favor of a national health insurance nonprofit program. But they decided that on their flyers that they're handing out, where on the front they have all their candidates that they urge people to vote for. On the entire backside of the flyer is the language of our referendum, and it says the Dunn County Democrats urge you to vote yes. And they're handing that out to all the voters in Dunn County. I have sent a message to some conservative groups and to the Dunn County Republicans as well. I have not heard back yet to see if they would let me come speak at their events. Our Wisconsin Revolution has printed up about 10,000 flyers, which I show you here, that say vote yes on the referendum. And we're going to do literature drops into people's doors in October. And we're going to try to organize a letter to the editor campaign to the few local newspapers. And I know that the Dunn County clerk is going to do some things to promote it to the public, to let people know it's on the ballot. And there are some other events going on at the university. A neighbor of mine, Dr. Alex Hall, is hosting a forum where they're talking with students at the university about a single payer system. And my friend Monica Barrier and I are going to speak at that. And so we're going to be in quick motion here in October to try to spread the word and have those conversations that we urged the board to let us have.
Is this initiative applicable to counties in other states? And is it important for the activists to take such initiatives?
Yeah, I believe that it is. Yes. Get the wording, that you feel will work. If this works well in a county that votes for Trump, it may work in many other areas of the country. And what I must say about all the referendums that I've worked on, you need to have a champion. You need to have a local champion. And right now we are blessed with a number of local champions. We have Margot Hecker and Steve Hogseth that are on this call with me, and many others that have supported us in community conversations. And then we have the board. We have those 3 members of the board that have solidly supported this and that are doing a lot of the legwork with the campaign. So yeah, I think you have to have a nucleus in your counties that would go out and do this. You just can't, say, I want to have it, put it on the ballot without having an advocate that'll work for it.
This is a refreshing conversation. Several people have raised with us the issue of the wording of your referendum, which says it will cover all Americans. They're asking, doesn't that exclude those who do not have citizenship? And did you mean to do that?
Oh, it's kind of hard to put all those words in a referendum. I think that we have a broken immigrant system, and we have to get some laws. We have one party that's against creating laws because it's good politics to have chaos with immigration. So once we could, settle on that, these people that have, businesses that are illegals, but they still have businesses that contribute taxes, those people really should be able, to get health care. But, with the way politically it works, we have illegal aliens that come to our country. They're drawn here. They're taken advantage of by wealthy people that want to pay them very little and want to keep them under their thumbs because they're illegal. They just don't allow us to, get rid of this terrible system that we have with immigration. And if we held them all responsible, all those employers responsible, that they're hiring people that are illegal, if we could say they all have to have green cards, if they don't have green cards, you can't hire them. I just think it's a terrible problem that the ultra wealthy are taking advantage of these immigrants. So I don't know if John wants to say anything about that, but I think that's one reason why it's really very difficult. Immigrants are made out to be bad people to, the far right. And so it's hard to be able to include that kind of wording in there in our limited, explanation of what this referendum is.
Yes, and in one of our healthcare committees, one of our committee members brought this up before we settled on the language. And we had to think about where it was that we were introducing these resolutions. And it was a strategic move to not use language such as to cover medical care costs for everyone living in America, or something similar to that. Because as we thought on, and we deliberated a while about it, because we didn't want to feel like we were deceiving county board members. We didn't want to feel like we were betraying our own values, because everybody to a person in our Wisconsin Revolution feels strongly that immigrants, undocumented or otherwise, should be covered by our health insurance system. But in order for this conversation to move forward, we thought it was a strategic move to not use the language of everybody living in America, based on knowing where we were bringing it to. And we decided that that did not betray our values, and that if you take it step by step by step, if this program were to be implemented finally, due to the costs to taxpayers and to the government, it stands to reason that one of two things would eventually occur. We would cover everybody in America living here due to the costs, or we would really move to address the immigration problem that we have, and the how long it takes to get your citizenship, and to move towards not exploiting the people who come here for a better life. And so, in all honesty, it was a strategic decision, because the main point is to get this on the ballot and to get the conversation started. And we know that these county board supervisors And we don't look at them as bad people or right-wing, conservatives who are beyond help and are racist. And it's just we're living in a time where the propaganda seeps in, and we just wanted to avoid that channel of the conversation. And so it was a strategic move. And in order to get the steps towards what we want to accomplish, we thought that this was the first step.
Some of us it's a really important issue. And some of us have suggested that language that said cover everyone in the United States would be more appropriate. What would you think of that?
We obviously anybody in any county or municipality can word it however they like. We're not we don't own, just because we got it on one ballot doesn't mean that we're in charge of what anybody else can do. And I think that sounds good to me. And maybe that would be okay. Maybe if we had used that language, it still would have passed Dunn County. But we're sort of riding on the success of this one. And if it did say that, we would not be opposed to it. We would still support it. But I think going forward in Wisconsin, we are likely to stick to the language we have and see how that goes. And a big point of seeing if it works or not, we'll see how successful it is in Dunn County. And yeah, so I think that I understand everyone's concern. I think everyone should be covered, but I think that this is the step that we chose, and it worked really well in a rural county. And so we're going to keep on with that for now.
We appreciate your explanation, even for those of us who don't agree. But it's important, I think, for those principled issues to find their way into our discussion. And you Dunn Countyans who have so much confidence in your people, perhaps they would do better on this than you think. Anyway, I'd like to ask I think you've answered, how much does the county spend on employees' health insurance, and does that give them really good health insurance?
John's probably best able to answer that because he's on the board and he knows what kind of insurance that they get. But apparently, according to Monica Barrier, they still run into trouble with an insurance company not wanting, to cover services. Is that correct, John?
Yeah, that's right. They do have decent health insurance, and thanks to the Health and Human Services Department of the county, they spend a lot of time making sure that they search for the best care, the best, most cost-effective care for their employees. And we've moved recently into a self-insurance program where people are incentivized to get physicals and to get care. And the employees generally seem to like it. I guess I'm not sure how deep the polling of the employees goes, or how much what they base that on. I'm told that they're doing well with it in the scope of our health insurance program. But just the constant search for something better, the costs of the insurance in general, even though the care seems to be something that is sufficient and that the employees enjoy, it's not, there's still that insurance. I guess the county has taken away the insurance middleman, but due to the major system that's outside of a self-insured program, the continued for-profit system that engulfs the whole country, all of that is continually chipped away at and plucked away at, and you're continually having to make sure that you're getting the best service. And so it's the profit-based nature of all of it, and the pharmaceuticals and everything that people need, that it seems decent for what they're paying. But if you think about what they're paying, it's insane. $500,000 every month.
And what would it mean for the county budget if we had national publicly funded healthcare for everyone?
It's unimaginable what it could do. And the thought of that makes supervisors giddy. And I know that outside of the county board, due to the propaganda and everyone's concerned about their own family's budget, they would think that when if this is implemented, that their own taxes would go through the roof. And even though there's study after study that shows it's what those taxes would, the amount that it would be raised is less than what you spend on your family for health insurance or medical care costs and pharmaceuticals. But I mean, the cost of everything is going up. All the materials they use to pave the roads, all the equipment they use to plow the snow, everything the state mandates that the sheriff's department covers. In the last couple of years, Dunn County had to cut their home health care program, which was one of the saddest moments I've ever witnessed on the county board. It was one of my first my first budgets that I experienced. And I saw these wonderful people who, the home healthcare program, it brought healthcare to people in outlying rural areas who couldn't get into the hospital into Menominee in the dead of winter. There were county employees who would go and administer healthcare, check on people who were living alone, people who couldn't get around very well. And we had to eliminate the entire program, which also eliminated, I think, a dozen jobs in the county. And so, as I was saying, how they have to, you know, cut $1,000 here and $100 here when they have to balance the budget. I mean, to think of what $500,000 every month would do, it would do everything. And we had recently a wheel tax was implemented in Dunn County. And what that is, for people who don't know, it's an extra certain amount of money that goes onto your vehicle registration every year. And it's one of the few ways that Wisconsin counties are able to raise revenue. And it's an extra $20 every year for your vehicle registration. And there was an uproar in the community because it's something that they can see, it's something that they feel. And that in total, I forget, Monica told me recently that it raises somewhere in the area of $700,000 a year for the county. It might even be less with just that wheel tax. And that, you know, basically a month of health insurance for its employees. So the benefits to the county would be huge. One of just 72 counties in Wisconsin.
Mm-hmm. And that was an effective part of the presentation. I know Monica Barrier spoke at one of the meetings and talked about the wheel tax and the costs, and that was effective with the commissioners.
It was, and it's like I said, how everybody knows that the system is broken, and conservative members who really weren't prepared for this question to come to the ballot. They weren't prepared for Lorene to bring it. This is not something they thought that they would be deliberating about at the county level. They really thanked Monica for bringing that up and for pointing out how much of the budget goes to it. And that was one of the main keys of why we brought it to the counties. It's getting down to the nuts and bolts of how things function in this country, and appealing to the people who are making it function and doing their best is really the way to go. And to try to draw people in and tell them that this is not political. This is about your neighbors. This is about your friends and your family and your parents who are going to go and you have to deal with their care when they get older. Like, how are they doing? How is this stress level? And for this country, as things are sort of shifting politically, it's hard for us to tell because we are the frogs in the boiling water, but a lot of issues are mixing and matching in the middle over these last few years. And this is one of those issues where you can go to your neighbors and say, have you noticed how your country seems to have an extra $10 billion every week to send to weapons manufacturers for Ukraine? And people will notice that, and people will talk about that, and they'll say, you know what, I do deserve this, and this is part of where my tax dollars should go. And I feel like the fact that conservative members of a county board who see how the budgets work can see it, then they can sort of pass it on to their constituents and their families. And, you know, things change. And even though we're stagnant and we're divided in this country, we might be in the midst of things changing. And I said this to you, Kay, in the last interview. When I heard Donald Trump say in an interview in 2015, when he was running, Scott Pelley in 60 Minutes said about healthcare, and Donald Trump said, everybody's going to be covered, everybody. And he said, oh, well, who's going to pay for that? And Trump said, the government's going to pay for it. And he didn't do it. He didn't try to do it. He was a con man and everything we know about him. But when he said that, there was no pushback from the people who supported him. They didn't say, no, that's ridiculous. That sounded good to them. And so we are at a shifting point and a tipping point. And for all my neighbors and my friends and family and everybody on here and my little kids making noise in the background, we're going to keep pushing until we shift this into everybody being covered.
Okay, well, on that very positive note, I'd like to introduce to you Dr. Judy Albert. She is a physician in Pittsburgh. She is an activist and a leader in Physicians for National Health Program, and she is on the steering committee of National Single Payer, and she has been monitoring the questions that the audience has been putting into the chat, and will be posing those questions for the final segment of our program.
Okay, well, the chat was very active, and I want to thank Steve Carlson, one of the Dunn County, I don't know if he's a supervisor, but he was very active in writing your referendum, and he answered many people's questions as they were being posted in the chat. So thank you so much for that. So some of the other questions that didn't get answered, one big one is, are you aware of private insurance companies spending money to defeat this referendum in Dunn County?
I am not aware of any opposition that we have. I have stayed away from the Republicans. I did, and with some of my referendums, we had to be very careful that, you know, we didn't put signs just in lawns of people that were Democrats or progressives, because they pick up on that. They know who their neighbors are. So that's one mistake that we've done in the past. But I am not aware of any kind of opposition. I haven't heard of any kind of opposition.
Nor have I, not yet. It's still sort of under the radar, and I'm not sure that we will in Dunn County. And what I'm imagining is that if our efforts in the next month, in 5 weeks, are successful and we get 60–70% yes vote on this referendum, and we start to push it into other counties for this next spring election, where there will be a state Supreme Court judge on the ballot in the spring. And so that'll be a relatively big election. If we start to push this to other counties, I'm sure we'll feel that bubble up. And we've had some decent press coverage, more decent thanks to Kay and her article in Common Dreams, and really haven't had much opposition. It's hard to describe. Like, this is a county in the United States, but I went to the next county board meeting that we had after this passed, which was they take August off in Dunn County. So the last county board meeting was last Wednesday, and I talked to many supervisors, and they went on with the business, and not one person even mentioned it to me. They're just on to the next thing.
Just business as usual, huh?
That's right. Not yet.
And you know, there were questions about local media coverage, which I'm not sure who answered it. They answered that there has been local media coverage, but they were using the descriptors that you studiously avoided. And would you like to comment on that at all?
Yeah, the reason that we are specific about the language is because it matters, not just to avoid the buzz terms that are polarizing and politicized, but because saying national healthcare program is sort of akin to what they have in the UK, where the government, the doctors and the medical professionals basically work for the government. And that's not what we're talking about. We're talking about a national health insurance program where the government pays for the system that we already have in place. And so that's just part of the conversation, and whether it's media outlets or the organizations that are even working on this, and neighbors and friends, and I think helping people learn what the differences are in those terms, what it would mean when people are, and I've had this in media interviews as well, the typical concerns that people have: the government's going to be making my healthcare decisions for me. You can remind them that your health insurance companies are actually making your decisions for you, and they are making it much more difficult. You have to go to your doctor and then to the health insurance and then back, and they'll only cover this, and so we want to be really particular about the language. And I think it's just part of the process of helping people, whether they're in the media or whether they're friends and neighbors, understand why we use this language and what the language means.
Great. So along the lines of the referendum, in the past, have there been any sort of similar advisory referenda that became law?
Not lately, because as I told you, our Republican legislature does not listen to us.
Okay.
Yeah,
They go according to what the national people tell the Republicans, and we have Voss kind of runs our state, and he's the Speaker of the Assembly, the lower house. So unfortunately, we don't get paid much attention to, and our individuals that represent us, even though they seem to have important positions on their committees, they still can't advocate for they can advocate in small ways, but not on big policy. So we've really failed since 2010, to do anything significant here in Wisconsin.
So it'll be huge if it passes.
That's right. And I in years past have been dubious of advisory referendums and the time spent on pushing them and the activist work that goes behind it. But I've realized now that when you're trying to change a conversation around something, every little bit helps. And I look to the legalization of marijuana issue. It's one of those things in Wisconsin and in most other states across the country where it has the numbers of people who think that it should be legalized, not only medically, but recreationally, are the majority everywhere, including in Wisconsin. And so you could say that referendums like that have passed and resolutions have passed, but in Wisconsin, due to the makeup of the state legislature, it has not passed. However, in the country, just 10 years ago, I think maybe only California had it medically, and now it's just starting to slip into the ether of the country through all these groups who push it. And whether the one particular referendum makes it into law, it starts to just change the shape of the issue and how people perceive it. And sometimes it takes a lot of time, like the marijuana one is taking a little longer than perhaps gay marriage and things like that. But once the culture shifts, then it's sort of a downhill slide towards getting that stuff enacted into law. And it's not easy, but that's what we're trying to do. And that's why I think these things are important.
So when it does pass, your referendum, what are the next steps that you all might be planning?
Well, I have talked to somebody from Eau Claire County, and they're watching to see how we do here in Dunn County before they even consider, this is a board member, even consider putting it on their ballot. So it may just take looking at what we do and what happens next spring with some of the other counties to make this snowball. Usually in Wisconsin, what happens is all these referendums start in Milwaukee and Madison, and then they spread to the rest of the state. So this is pretty unusual for this one starting in Dunn County.
Yeah, that's right. And our Wisconsin Revolution is currently in talks with people in a few other counties in the southeastern part of the state. There's Outagamie County, and I'll just name them because I'm sure you people across the country would like to hear the fun names of our counties. Outagamie County, Marathon County, and Portage County perhaps, and then up in maybe Bayfield, Washburn. There's some places that are talking about it where we're trying to get some movement there. And as we said earlier, the key is we're going to have to build relationships with people in those communities to push that themselves, because we don't want to come in there and do it for them.
Right. So there were some questions specifically about the county, the composition of the county employees, such as how many employees does the county have?
They have about 350 employees.
350. And that's who you're paying $500,000 a month for insurance?
Yeah, isn't that amazing?
That's
It's
pretty
true.
astounding. And then do you have some history about what some of the county supervisors wanted to know? What questions did they have for you about the referendum? You gave us some of the information about would it fix things, but I just wonder if there were any other questions they raised.
They asked, is this under the purview of the county? Even talking about this at the county board level. And that's why the comments from Lorene and some of the folks that she brought to the meeting were important, that it wasn't about the county trying to solve this issue. It was about them putting the question to the voters. Some supervisors asked how much it would cost the county to put it on the ballot. And that was another reason why we think it went unanimously, because the county clerk had that information at his fingertips, and because the ballots themselves on the back side of the ballot had nothing printed, it would cost the county almost nothing to put it on there, just maybe $1,000 for the printing costs for all the ballots. They asked if it would be detrimental to the county's image if it failed. That was one question. And they
Wow, how did you answer that?
well, I said that I said if you're putting this on the ballot for the people to have this discussion and answer this question, it's gone from your hands as soon as it's on the ballot. It has nothing to do with you anymore. Mm-hmm. And I don't think people would view this as something that the county did wrong in letting their citizens who came in public comment to ask to be on the referendum have it on the ballot.
So another question that just came in, do you see for the two of you, do you see any value in working with counties across the country on following your example, with or without modification in the wording regarding residents versus Americans?
Yes, definitely. I mean, that's the idealistic goal, that it spreads all across the country to state to state and county to county, and that would be a dream come true.
Mm-hmm. Well, I think that is about all the questions. As I said, I did have several other written down that were already covered. Just to clarify this, because making sure everybody saw the answer. Somebody asked if there was a required number of signatures for the petition in advance of presenting it, or for the County Board of Supervisors to consider it. But maybe you could explain that a little bit. I think I heard one of you say that you took it straight to the County Board of Supervisors. And I'm guessing this works differently in counties all across the country, but yeah, Lorene.
Yeah, in our state, we can only do petitions to villages and cities and then get it on the ballot. The counties can't do it and the townships can't do it either. So, but they can have them, but they have to be, moved by the county boards or the town boards. So, I mean, you have to go directly to your town board or your county board if you want something on those ballots.
And it's not required to take a bunch of names to your county board. It's up to them.
It is up to them. And unfortunately in Wisconsin, with Wisconsin United to Amend, we brought a legal petition to River Falls, and they voted it down, which was illegal what they did. And we just didn't have the lawyers there to, protect the legality of the petitions. And so they, even though they had done everything appropriately, they never had a referendum on the ballot, an advisory referendum, because the city decided to squash it.
Yeah.
So we have a lawyer now with WIUTA. We've actually been able to push that referendum to over 50% of the population of Wisconsin, and they've all affirmed it by, greater than, on an average, greater than 70%, but we don't get listened to. But, you can have a lot of people that want something, and our legislature will not go for it, unfortunately.
Right. So it's going to be important for us because other people from other states and Vermont and Illinois have noted that they have some different local government rules, and that's going to be part of what all of us are going to need to do. One thing that I will do is I'm going to put the link in the chat for the organization National Single Payer, which is the sponsor of tonight's call. And I think I'm going to throw it back to Kay for wrap up, and maybe she has more questions.
Well, thank you, Judy. I think it's been a very interesting community discussion that we've had this evening. I love this. We all in the single payer movement are always looking for how can we make manifest this massive majority support that we have in the country in a way to change what's politically possible. And that's what we're fighting to do. And this may be one of the ways that people throughout the country can do this. So I would encourage everybody to look up your state laws and to figure out what is possible in your cities and counties and your state. I'm aware that friends in Illinois have something in their law where if they attend an annual meeting of the township, the people that attend that meeting can vote to put something on the ballot. And Dr. Pam Gronemeyer has done that in Edwardsville Township, and others have done that in another place in Illinois. So it's something we all have to look up and do our homework and to see if this is one of the ways that can promote the kind of mobilization in an organization to finally make what is the opinion of the people of our country manifest in the laws of the country. So I think we're grateful to Dunn County for making this positive effort. And we thank John Calabrese and Dr. Lorene Vedder for your work there and for having the willingness to tell us about it. And we thank our audience for listening in and being a part of this community conversation this evening. And thank you all for joining us. The session has been recorded, and the recording will be available at that little @ NSP Healthcare. So I encourage you to go there and to shout.